Delighted to introduce Professor Sharon Friel, Director of the Planetary Health and Equity Hothouse at the ANU. And I'm going to hand straight to Sharon with the topic around preventing planetary health inequity, a key pathway to wellbeing. Thank you, Sharon.
Thank you. Thank you. So I don't need them, yeah? See, this is when you're small, where lecterns, you disappear behind the lectern. So let's see, I may stay here, I may just go random. So thank you so much for the invitation to speak. I said I want you to really emphasize prevention, so let's see what happens. We think about planetary health equity as the equitable enjoyment of good health in a stable Earth system. And to do that, it means really paying attention to climate change. Of course, there's many other aspects of planetary health. We focus on climate change. And particularly when we're thinking about the inequities aspect of this, climate change exacerbates the already existing social and economic inequities in this country and around the world. So I would say if we want to do something about climate change as it relates to human health and well-being, we have to do something about social and economic inequities. So that's the first prevention challenge for us. Because if you think about the effects of, I've got the picture here of Lismore, the effects of the floods, which happened twice in a number of years here in Australia. What happened with Lismore, so yes, floods are going to get more frequent, more extreme as a consequence of climate change. But the people who were most affected by those floods were those who were already most disadvantaged in society. And there was little action, little learning that was taken from the first time it happened to the second time it happened, other than some of the acute emergency responses, which are vitally important, but they don't help society prepare nor address the factors that are contributing to the poor health and well-being that's already there. So if we want to do something about this intersection between climate change, inequalities and health, planetary health equity, I would say we've got to think about both adaptation and mitigation. But my argument is going to be that mitigation is the biggest preventative health and well-being intervention that exists. I don't have time to spend time, to focus on the adaptation side of things. But in public health parlance, which is where I come from, that's like treating people who are already sick and then sending them back into the conditions that were causing it in the first place. Very important, but doesn't get at the root of what's the situation. So I do want to spend most of my remarks speaking about how do we prevent emissions, and if we do that, we're going to prevent health inequities, well-being inequities. I think I'm getting old, because I've been speaking about health inequities for probably, well, about 30 years now. And well-being has been in the mix all the way along. And I'm just really impressed that we're in a room for 3 days where well-being is the focus. But I do reflect on, we've been saying this for 30 years, but anyway, I'm going to come back to that in a second. So how do we prevent emissions? And that relates also to how do we prevent people from getting sick? How do we keep people healthy and well to begin with? And so the way we speak about this in the Planetary Health Equity Hothouse is this consumptogenic system. It's a fancy way of talking about capitalism. But I didn't talk about capitalism because we wouldn't have gotten it funded. That's a joke. Not really. But it's also, I think, a little bit more, it puts a little bit of specificity into the language of capitalism. The system, the actors, the institutions, the commercial activities, the norms, all of them in a system. I'm not going to talk about consumers at all. I'm talking about this system of policies, institutions, norms, power that has absolutely baked in, incentivized, rewarded the excessive extraction, production and consumption of fossil fuel goods and services. They're killing the planet. I know we were fighting about this messaging yesterday. They're killing the planet. They're killing people. They're making us sick. So if we're going to do anything about planetary health equities, if we're going to do anything about health and well-being, we've got to do something about that consumptogenic system. We've got to prevent that system from persisting. And that, to me, is a contestation of ideas, interests, and institutions. And I'm going to pick up on these three things throughout the remainder of my remarks. There are inequities in ideas, interests, and institutions. Right now, the dominant ideas, and ideas, we were talking about, is it evidence or is it ideology? That is a nonsense distinction. Nonsense. Every single person in this room has a worldview. That's a paradigm. That is ideas. That shapes the types of evidence, the types of ways that we think about evidence. So please don't tell me it's either evidence or it's ideology. And the dominant ideology, the dominant ideas, the dominant paradigms, the dominant worldviews that are driving that consumptogenic system are some of the ones that are up there, which makes us think about individualism. It makes us think about efficiency. It makes us think about, well, the things that are up there. And that elevates these different interests. It allows the economic growth, the unfettered economic growth that we've been talking about. It allows the, whatever's there, profiteering at any cost. It allows a technological interest, and it allows a biomedical interest to go forth and dominate, which is embedded in our institutions. Institutions are simply the rules and the norms that it sets the rules of the game, whether that's in government, whether it's in markets, whether it's in civil society. And I would argue one of the most egregious things that has happened to us is new public management, new public administration, because that has allowed an efficiency argument to dominate. We've also seen the rules that have been set in place that says it's about the markets. Who said that was the case? And I put quantification in there because I've been reflecting over the past couple of days a very recurring theme of numbers of quantification, and I'm going to come back to that. So if we're going to do anything about prevention, if we're going to do anything about keeping people healthy and well, if we're going to do anything about climate change, we've got to acknowledge, or I would suggest we've got to acknowledge, ideas, interests, and institutions and work out how we rebalance these. So how might we do that? I'm going to put this up. This is my 4-point plan for how we change the world. But I've put the picture of the person in this is my pathetic attempt at drawing, in the middle. So that's the governance triangle. Yep. Today, there are, of course, state actors, there are market actors, there's civil society actors, and we're all moving around trying to influence the course of events. We've all got different ideas, different interests, and there's different institutions in those worlds. But we've all got power. every single person in this room, every single individual, every single organisation, every single actor has power. That's what that wee person is supposed to, agency. And it's the expression of that that really matters. It's the expression of that through the embedding of a new paradigm. So we've just spent 2 days talking about a new paradigm, a well-being economy. That's a different way of thinking about, what's the purpose of the economy. Releasing state capacity. We've spoken a lot, we've heard a lot. I mean, I just think it's incredible what the folks in Treasury are doing at the Commonwealth and at the states and territories. I think that's amazing. That's a different paradigm. We might argue about whether it's enough or blah, blah, blah. That's a new paradigm get embedded through the state. I talk about taming the beast, sorry to the business folks in the room, but some business and finance practices are just evil and just really harmful. And that has to stop, and I'll come to that. And then, how do we release the influencers? And I'm not talking about the social media influencers, although they are very important. Maybe, where's Gary? Gary's about to do TikTok. He's going to become a social media influencer. So no pressure, Gary, change the world. But that's all about strategic mobilization. So yes, how do we make the impossible possible? As I say, we spent 2 days talking about the goal of economic policy, the goal of the economy being well-being. For the health folks in the room, the well-being health folks in the room, also, can we think about health policy, which isn't biomedical policy? Let's shift that paradigm, make it eco-social perhaps. And what's the wider goal of society? For decades now, we've thought it's economic growth. Can we stop that, please? Actually, what Western liberal democracies were all about was growth plus liberty plus justice and equality. And we've somehow forgotten about those two other things. Let's elevate those. So what I've heard in the room, though, the past couple of days has been a discursive power being operationalized. We've been talking about clients. We've been talking about business cases. We've been talking about metrics. That's not going to get us, that's not a paradigm shift there. That's a holding the status quo. So just the choice of language matters. We were doing that messaging system session yesterday, which was brilliant. And that was really hard. I'm looking at Mike. We were at that table and I'm like, oh my God, I can't do this. I'm an academic. This is ridiculous. But it was so good trying to get us to think carefully about our language, because that's power. So please let's stop talking about clients, for goodness sake. These are people. The other thing then is the releasing state capacity, ambitious public policy that's going to do something about climate change, inequities and health. So the nationally determined contributions, really important government strategies that set our climate targets, or that suggest our climate targets, what we're going to do in climate adaptation, climate mitigation. If you haven't heard about the NDCs, you should have, because they're really, really powerful. And we looked at the Australian one, so we asked the question, do governments discuss social and health equity aspects in the climate mitigation policies? Remember, one of the biggest prevention policies, and of course they don't, but they could. And we're having really, really important discussions here in Australia around how to think about the nationally determined contribution strategies, the mitigation aspects of that. Don't just focus on the economics, look at all of the other areas. These are a whole load of other words, other frames that are in the NDCs, but we could elevate them more, and that changes the focus. And then, in public policy, stop doing privilege. we've spent a lot of time talking about kind of social disadvantage or addressing those with most needs in society, and that's really important, I'm not suggesting. We talk about levelling up, which turns a blind eye to and silences attention to how our public policies continue to reinforce, shift up advantage to those who are already advantaged. And it doesn't have to be like that. So in Australia, let's think about our growth model. Australia's growth model, it's a domestic consumption-led growth model. Some countries are export-led, we're not, we're a domestic consumption-led. And it used to be through wages, it's not now. It's about assets, you were talking about this yesterday. It's about assets and credit. It's about easy access to credit, i.e. getting people into debt. And it's about housing as a commodity, housing as a way of making money, investments. And the consequences of that, of course, has driven up house prices and the level of indebtedness. Australia is the top line there. It doesn't have to be like that. We made a political choice to do that. The consequences for people's health and well-being are profound. The long-term mental health effects of housing affordability stress, the longer that goes on, our mental illness increases threefold. So it's also, of course, increasing economic inequities. And we have some of the biggest houses in the world with the biggest environmental footprints in the world. Housing policy is a really important intervention, a really important prevention policy. But of course, people don't want to touch it. Politicians don't want to touch it of all sorts of colours. And there's a reason for that. There's a reason why our politicians are terrified to touch it. And it's because they love looking after those who are already privileged in society. So my marvellous colleague Ashley Schramm has done this analysis where she's been looking at the, I have to read the numbers now. So the richest 200 people in Australia accounted for 24% of Australia's GDP. They make their wealth from 11 industries. Most of it is mining, technology, and property. Mining, technology, and property. We subsidise mining, and we don't touch the property folk. It doesn't have to be like that. And it matters. That power and influence absolutely matters. Because what it's all about is continuing to be left to their own devices. Don't touch us, we are part of the solution. Please don't regulate us, we'll do it ourselves. We want the social license to operate. So until we put some guardrails, imagine if we actually taxed them. Imagine if we had that land tax. I'm pointing to you, there was somebody talking about land tax yesterday. Imagine, touch them. Touch them, what's going to happen? The country's not going to fall apart. Just touch them, bring them into some degree of actually looking after us, which is what we're supposed to be about, and the planet. And incentivise the variety of business models that we were hearing about yesterday. Incentivise them, create a regulatory framework that actually is fit for purpose. Because otherwise we're going to continue to see these sorts of pictures where our Prime Minister was going round the country to try and encourage the yes vote for the Voice referendum, and Rio Tinto rocks up with a top that has his name on it, just per chance. That's about creating a social license to operate by Rio Tinto. Don't touch us, we're part of the good guys. It's nonsense. So my final remarks. What do we do? How do we change that? Well, of course, government, but we, some civil society folks in the room, we have power. We have incredible, incredible power. Sorry if you don't see your logo up there. And I don't know what happened to my Wellbeing Economy Alliance. It's gone, I've lost the words, that beautiful symbol in the middle there. Raising collective consciousness, building a power base. Please don't think it's about you as an individual. This is about a collective power base. This is a power game. It's a collective power base, shifting, raising collective consciousness, using different types of evidence. Please don't just give me a number. Let's talk about all sorts of data that can be in front of the right people in the right way at the right time. That's about those narratives. The knitting nanas are amazing. The knitting nanas talk about how climate change, our children, our grandchildren won't have a planet because it is killing people on the planet. And the knitting nanas are out there. They're not saying it's about intergenerational fairness, but it's all about intergenerational fairness. But they speak about it in a compelling way. And then, of course, pushing for political commitment. This isn't about pushing down on community to solve the problems. This is about pushing up to change those power inequities. And I'll leave this on the screen. What are you going to do? How are we collectively going to get out this room and make those sorts of changes? Whether you're in government, whether you're in business, whether you're in civil society, each of us can't do all of that, but we can do all of that collectively. And it's seeing the intersections, seeing the colleagues. This is the Wellbeing Forum. I'm horrified that more of my health colleagues are not in this room. That's an easy alliance. And there's so many others that could be here, the Climate and Health Alliance, etc. So thank you. Do we have one?
Yeah, grab a seat. Thank you, Sharon. And I can't at the moment see any questions on Slido, so I will open up to the floor. We have a few minutes for a couple of questions from those prompts. Would anyone like to react, respond? Craig up front, then Di.
Thank you.
Thank you so much. Thank you so much, Professor. First and foremost, thanks for the dinner. What I'm holding is the Bega Valley Centre of Excellence, an opportunity for clean energy for the future. It starts off with an executive summary for the potential of setting up a centre of excellence in climate change, but we're going to expand that into wellness. On southeast New South Wales, the Centre of Excellence will promote innovation and collaboration, research and development. But we've also got case studies, as you spoke about, Professor, in other areas with correct data. I'll furnish you this after this. So this is the benefits of a Centre of Excellence. The presence of a Centre of Excellence would diversify our regional economy, kickstart new industries, and encourage private and public sector investment in renewable energy generation, plant manufacturing, efficiency products and strategies, and the various forms and outcomes for regional economies, and social economical benefits, framework for the Bega Valley Centre of Excellence, partnerships, education. So that's it.
That's it?
Yeah, so thank you.
Fantastic.
You've got it
Thank
sorted.
you. Yeah, that's wonderful. Thank you. It's okay.
Thank you.
Put that here. To Di. Thank you, Craig.
Thanks. Thank you, Sharon. That was wonderful. Provocative, as we expect from you. Thank you. The conference has been great. It's all about action. And you've given us some points on what we need to think about. I want to ask you a couple things. One is, how do we get comfortable with this uncomfortable discussion? because it's hard to talk about economic transformation because people, you know, like our friends and family, they kind of go, well, you know, what do you mean by that? And it's kind of, you know, controversial, right? The other thing is, as I said, you've done the 3 questions on, you know, what do you stop, what do you do? If walking out today, what should be maybe a few ideas of the things we should do this week, next week, in real practical terms?
So can I, let me come to your first point of being, why does it matter if we're uncomfortable? I don't take the premise of that. Get over yourselves. I'm joking. You know, you're not doing anybody any harm. We're having a conversation.
Pretty deeply seated though, feeling uncomfortable.
Yeah.
So we can get over ourselves, but it takes a lot to be able to feel confident, to feel secure, to be able to do that.
Well, and that's where your second question, if you think it's just about you as an individual, then I think that's a lost cause, in a sense. So I might feel comfortable going into a room and having a conversation. But I'm not going into that room alone. The idea of going in as a collective. So I want to be in the room where the economic reform roundtable, the next one, we are going to be in that room. I may not be happy to speak up, somebody else might be happy to speak up, so we've got each other's back. One of the real lessons from social movements, and as an academic I spend my life in these literatures, is the importance of having each other's back and the importance of not fragmenting. So one of the great things that we do on the left is we eat our children. Not literally. But, you know, we split and we say, I mean, Catherine and I have had this discussion before, like you're just the upset about why the well-being economy, the degrowth, people, like we're all in the same, we're trying to move in the same direction. Let's not fight about and certainly let's not do that publicly. So having each other's back, and that actually, which is why the Wellbeing Economy Alliance in Australia is really important, because there's a space for us to get together collectively and strategize. Strategy and tactics are vital for this. It's not just we rock up into a room. It's like, what are the tactics for that? I, of course, blathered on too long, so I did have a slide that you'll get in the pack with and it's actually got a whole range of inside and outside strategies for doing this.
And I just want to build off that, Sharon, because one of the questions that's come through is just an example, perhaps, of where, from somewhere else in the world, perhaps, where people power has won over vested interests. So that idea of the collective coming to the fore and changing things.
So can I... let me give you the example that I often use is, so it's to do with trade and investment. Yep. So trade and investment, all about business interests, really trying to advance. And there was a big health win in a trade and investment treaty, TRIPS, the Intellectual Properties Treaty. It's called the Doha Declaration for Public Health. So TRIPS, that agreement, that trade agreement, was so big multilateral. You can imagine the politics that's involved and the negotiations, trade negotiations. TRIPS is all about advancing intellectual property rights. Big pharma loves it. Big fossil fuels love it. Every big corporation loves TRIPS. because it's about their intellectual property rights. And it was around the time when HIV/AIDS was rampant. South Africa population was being decimated from HIV and AIDS. And the South African government said, we've got to get access to medicines. But of course, intellectual property rights means proprietary medicines, pharmaceuticals, which is, for some countries, some populations, unaffordable. So South Africa, India, a number of other governments coalesced. And they were able to coalesce because civil society, the ACT Medicines group in South Africa, the global international group around access to medicines, the international civil society groups around inequities, I just can't remember what it's called, coalesced. They had persuasive framing, strategic narratives that was talking about corporate greed kills, and they had banners all over the place. And so it was this combination, and the trade lawyers, the progressive trade lawyers, were working with the civil society groups and the governments to get the right sort of evidence in front of the right sort of people at the right time. So it was this kind of coalescence of this technical evidence alongside some ambitious, courageous governments, alongside civil society groups, that enabled the governments of South Africa and India to go to the World Trade Organization and say, you are killing our people, this has to stop, we need access to medicines, we need access to a mechanism in this trade agreement that allows us to create these medicines ourselves, and they got it. That was massive.
It's a fantastic example. Thank you, Sharon. We do need to move to a comment then, perhaps. We don't have time for questions. So, sorry, it's. We'll do it. Okay, there we go. The people power, people power over the vested interests. Perfect example.
Thank you, people. I'm Suzanne from the Federal Treasury and the Australian Centre for Evaluation. So our mission is to put evidence at the heart of policy design and delivery. Really excited to have responsibility for the Measuring What Matters framework, and really keen to identify specific mechanisms to work with academia, because, we in government generate really rich research and evidence, as does academia, and I think pulling that together is just so critical. So, Sharon, it was beautiful. I think you've already touched on so many of these things, but what are the specific mechanisms that you think we can use to bridge that gap between government and academia?
One of the most important things, I think, are those coffee conversations, to begin with. Coffee conversations is all about our mental models and seeing how understanding, building relationships, building trust, building respect. First and foremost, coffee conversations. It was one of the best pieces of advice I was ever given as a young academic. The second is, so for us in academia, so I see Matt up at the back. I'm not picking on you, Matt, because I think actually you're doing such progressive work down in Victoria. But I keep ribbing Matt about all this quantification or blah, blah, blah. But imagine if academics and folks like yourselves got together and worked out, how do we take qualitative evidence and transform it in a way that's actually going to travel through the system? And we can do that. So let's get, so there's, let's do it.
Fantastic, thank you. And just the vested interests will take control once again. Thank you, Sharon. And I will read out just one of the comments here. Sharon, your work is absolutely brilliant, critical and inspiring. I agree with everything you said and love the way you said it. Thank you. Thank you from all of us. It was a wonderful session.